I was diagnosed with breast cancer. I could not work. I had to go through the therapy. The way I would think the Riverside Tree of Life Foundation is to ask them, what can I do to give back to that fund? Because I was so grateful. And I will never forget that. It just gave me so much hope. I had lost hope. I totally lost hope. But they were right there.
My name is Becky McCoy, and I am the chair of the Riverside Health System Foundation. One of the things that Riverside is very, very good at through the hospital system is providing a lot of charity care to our community. We raise money for the things that you just normally can't do through a regular healthcare system.
Our mission statement is kind of based on the golden rule. We need to take care of you like we would take care of our family, in other words. I think that Riverside sets itself apart on that.
We here in Riverside Cancer Center, we try to practice Dr. Mark Ellis' vision of not only treating the disease itself, we treat the body, the mind, and the soul.
Mark Ellis was my husband, and he was an amazing person with an amazing history that began with a terminal illness with cancer. And he had a 0% chance of surviving, which he found out at the age of 18 with a brain tumor. He embarked on 5 years of experimental chemotherapy. He amazed everybody by actually surviving. When he survived, he decided to pay it forward, and he became not only a doctor, but he became an oncologist. And he served cancer patients for the rest of his career until in 2010, he passed away at the age of 59, again due to cancer. One of his approaches had to do with something called integrative medicine.
Integrative oncology versus traditional oncology is basically building an oncology program around the individual. You build the medical aspect, you build the emotional aspect, you build the social aspect, all around the person, not as a patient, but as a person.
I'm a cancer survivor myself, and I know what it's like when people, the doctor says, "Oh, you have cancer." Oh my God, it's like deer in the headlights, and so you have fear. That's the first thing that comes to you. How I'm going to make through this? You know, am I going to live to see my kids? Those kinds of things. And so when there are people that you can call and say, "I'm feeling this kind of way, can you help me kind of work through this, or can you help me to get through this, or can you help me to get this medication, or can you help me get to my treatment?" And when you do that, oh my God, it just feels so good. You can help them right then and there because the foundation is available.
Finding a patient sometimes that's in need, and then how do you help them? What are their needs? It's, they're going through a devastating process where they're getting treated and then they cannot work. And then they're having oftentimes young children that, they're trying to care for and help through that process. And having the foundation just alleviate some of those needs that they have, it just seems to help the patient's family life ease a little bit.
So it became clear in 2007 that in order to continue this fabulous program of care, we needed to develop a fund to support it. We got the fund going and put it under the Riverside Foundation umbrella.
My wife died in 2005. I wanted to make a kind of a living monument in terms of what she meant to me and what she meant to the community and her struggle with life, and a way to pay back yet contribute. And the way I like to do that was through the Riverside Foundation.
The Tree of Life is made up of leaves, some acorns, and it has all these different components to it. And based on the level of giving, the donor's name, or if they're giving in memory of somebody, that person's name is inscribed on the different parts of the tree, and they're there forever.
If you have had cancer, know a loved one who has had cancer, and you have watched them go through their treatment, think about what you saw, think about a cancer patient's journey, and why wouldn't you support a program like this? It's extraordinarily important.